Okay, welcome everybody. I am Lyle Mons. I work as an advocate for the AIDS Foundation, but today I am here as your moderator. We are here at the second event of Health and Prosperity. We had one session at the Kid Royal Tropical Institute in Amsterdam about a year ago, and this is our second edition because we really want to take the conversation to The Hague, where the decisions are made also about the future of international collaboration. A couple of weeks ago, it was World AIDS Day. And as an employee for Aidsfonds, it also got me thinking about where we come from and where we are at right now. And I just realized it's 30 years ago that they invented the combination treatment that helps people to successfully suppress the HIV virus. And I also realized that we came globally from a point where we had 0 people on treatment worldwide to a point where we had more than 30 million people worldwide on treatment, less than 30 years. And I think in a time of division internationally, to look at these examples of what we can accomplish when we work together in the international space, it's really remarkable, and we would almost think it's not possible, something like that. I see today in the room we also have representatives from Gavi, and I was just watching the numbers, 1.2 billion people vaccinated since that Gavi came to the existence. We have people from the Global Fund, 75 million human lives that were saved since its inception. I mean, the numbers are so high, it's almost difficult to imagine what it means in the lives of all these countless people. But today, we're going to talk about health, not just in respect to what it can mean in the human lives, but also what it means for the Netherlands, because we know that the global times are changing. The focus sometimes are also changing of governments, of parties, of the politics. So we really want to explore the importance of health on several fields. We're going to look at the intersections between health and security. We're going to look at what it means for prosperity and what the Netherlands also has to offer in terms of our economy to the table. And we're going to look at what health means to protect the lives of everybody here in the Netherlands, but also across the globe. And we have a great set of speakers. We will have 2 opening addresses, one from Peter Dirk Hoff from the Ministry of Foreign Affairs. You will kick us off, and then we also will have Crystal, who is here in the room with us from Uganda, to also say what she sees happening in her communities. And then we will go to our expert panel. I will introduce the panelists later, but maybe let me first do some small announcements. This session will last until 11:40, and then I'm going to ask everybody to leave the room except a smaller group who will continue the conversation here in smaller rooms. But don't worry, the people that will go to the Sociëteit, there's drinks for you there, and you can join and socialize there. I also wanted to say that we are being recorded. It's mostly the panelists that will be recorded. There's also photographs taken, and all those who do not want to be photographed, they have a green sticker on their note here. And maybe just to kick off today, I want to do a small poll. So I want to ask you all, maybe you can raise your hands, who does consider himself to be a full-blown global health expert? Maybe, so a very shy, modest room, I see. Who says, I'm still a bit of a newbie, I'm learning here today my first lessons in the fields of global health. Okay, so we have some new people as well, and who feels, I know a little bit, but I'm not yet there, I'm gonna learn a hell of a lot today. Okay, that is really good. Okay, so we tested the knowledge in the room, but first I would like to give the word to Peter Dirk Hoff. Thank you for being here, and please share with us your insights.
Thank you, Lyle, and thanks to KIT for organizing today's conference on global health and prosperity. And it's really a pleasure for me to address such a broad spectrum of stakeholders today. So let me start off with a self-evident truth. The global health ecosystem has delivered in the past decades. You mentioned some of the numbers, Lyle. Life expectancy in Africa increased by 12 years since 1990. Child mortality has dropped globally over 50% in the same period. Immunization has saved 154 million lives over the past 50 years. Maternal mortality has fallen by about 40% since the year 2000, and new HIV infections have declined by 40% since 2010. You all know the numbers. There is no better proof that development policies have worked than the health sector. And yet, the global health ecosystem is under pressure for a number of reasons. First of all, multilateralism is crumbling. The post-Cold War era is over. The liberal, rules-based international order, whereas democracy, free trade and multilateral cooperation stood central, is rapidly disappearing. Competition replaces cooperation, and this also affects support for multilateral agencies in global health. Traditional development cooperation, part of the post-World War II order, is decreasing. We see enormous cuts. ODA has rapidly declined in 2 consecutive years, and it is unlikely to bounce back. These sudden and profound cuts are disrupting essential services for millions across the global south. The global health ecosystem has also become increasingly fragmented, hampering efficiency. We are far from reaching universal health coverage in 2030 with over 4 billion people without full access to essential health services and 2 billion facing financial hardships because of crippling out-of-pocket expenses. So in order to remain successful in addressing health challenges, we cannot continue on the same path. And we need to ask ourselves the question, which roles do we still expect from the global health ecosystem in a world that will be drastically different from the one that we have known for the past 80 years? So let me give you my 2 cents in addressing this question. First, the ecosystem needs to continue providing the world with norms, evidence-based standards, and guidelines to ensure quality, safety, and effectiveness of public health interventions and policies. Secondly, cross-border health threats are an increasing concern. COVID has disappeared from our society's collective consciousness, even though at least 50,000 persons in the Netherlands have perished as a result of the pandemic. But we have recently seen mpox affecting countries across Africa and even Europe. We've seen Ebola and Marburg outbreaks in several sub-Saharan African countries. Outbreaks remind us that vigilance is critical. And the number of armed conflicts in the world has never been as high since 1946. Armed conflicts can fuel the spread of antimicrobial resistance. And there are clear signs that antimicrobial resistance has gone up steeply in Ukraine. We have already seen reports from hospitals across Europe that received Ukrainian patients. Infections do not respect borders. Health security should be a core priority of a new global health ecosystem. And a third role of the global health ecosystem should be increasing domestic resource mobilization. Only 3 African countries have reached the Abuja target of 15% of national budgets spent on health. The Accra Reset, the initiative of African countries endorsed by a broad group of heads of states to strengthen country ownership and health sovereignty, could charter a new course in the right direction. Reorganizing international support for global health could bring efficiencies. Donor-driven priorities have hampered country ownership in low and middle-income countries for too long. And partners should now align behind country priorities. Remaining donor funding should be as much as possible on budget, following the principle of one plan, one budget. Fourth, the global health ecosystem must keep its market-shaping power so that essential and life-saving products are available for everyone, everywhere. That is what UNFPA does for contraceptives through pooled procurement, what Gavi does for vaccines, what the Global Fund does for commodities for HIV, TB, and malaria, and the payoff is huge. Over time, HIV treatment prices have fallen from many thousands of dollars per person per year to below $45 for first-line regimens negotiated through Global Fund agreements. And the next frontier is the same logic for new tools, so they can be made available simultaneously in lower income and higher income settings. The recent rollout of lenacapavir for the long-acting injectable for HIV prevention in Southern Africa is an excellent example. Finally, the ecosystem must retain a rights-based approach that puts women and girls at the center and prioritizes reaching marginalized communities. As SRHR, gender equality, LGBTIQ+ rights are under growing pressure. A rollback does not only violate rights, it creates blind spots. When people are excluded from trusted services, they delay care, avoid the system, and outbreaks spread undetected. Key populations must keep a seat at the table in decision-making on global health governance. Civil society's roles as a watchdog and as a frontline service provider must be protected across the health ecosystem. Making the global health ecosystem fit for purpose should not be so much about merging or eliminating organizations, but about avoiding duplication, focusing at added value, and sticking to core mandates. Now, where does this all leave us? The Netherlands. Our policy letter on development, published last February, outlined that we will link health closer to our security, trade, and migration interests. To reduce cross-border health threats, we invest in universal access to essential health services and in preventing infectious disease outbreaks. We know that the legitimacy of multilateral organizations is challenged, but as a small country, our health interests can only be protected within a strong global health architecture. And that is why we will continue providing multi-year contributions to WHO, UNFPA, Gavi, Global Fund, the Global Financing Facility, and UNAIDS. And we will not cut our core contribution to WHO because we believe in a central role for WHO in the global health architecture. It is the only organization with a mandate to set norms and standards and to guide and coordinate international health action. Weakening WHO core functions would increase the risk of diverging national approaches to public health, leading to fragmentation. For example, through differing standards for ensuring drug safety and weaker global coordination in the event of a pandemic. Our global health strategy focuses on strengthening health systems, with the aim to improve access to basic health care and specifically to SRHR. We will maintain that focus. We also seek to create opportunities for Dutch companies to grow revenue by contributing their products and expertise to efforts aimed at boosting global health. Our private sector partners, knowledge institutes, civil society organizations are key assets in global health. They offer a highly relevant mix of products, research capacity, advocacy services, and innovation to expand access to essential health services while enabling Dutch expertise and solutions to scale internationally. We can help to scale partnerships that deliver results. One example is the partnership between Delft Imaging and Farm Access as part of the Combitrack Kenya. They are integrating the use of the baby checker, an AI-enabled tool developed by Delft Imaging, into pregnancy care in clinics across Kisumu country, strengthening the quality of care and reducing maternal and newborn complications through digital innovation. The collaboration between Batavia Biosciences in Leiden and IAVI Amsterdam contributed to the rapid development and production of an Ebola vaccine that was used by the WHO in the recent outbreak in Uganda. Some examples of the value of public-private partnerships and the Dutch expertise and innovations, and there are many more. Working on global health in today's world of multipolar competition is a challenge. In the words of Peter Sands, bilateral approaches are not the answer. Only if we continue to act together, we can continue to achieve results. So I wish you all a very productive and insightful morning. Thank you very much.
Thank you, Pieter Den Hoff, for these inspiring words also, and for the commitment that the Dutch government remains to have in the field of global health. It's also important to know who we are doing this for, and there's many people who we are doing this for, but one of the people is Crystal, and I would like to call you also forward. Crystal, I learned a new word today. You're an ethnomologist. I still have difficulties to pronounce it, but an expert in insects, I hope I say it correctly. And you also are a research and outreach associate in Target Malaria in Uganda. So thank you so much for being here today, and please take the floor.
Thank you, Lyle. Hello, everyone. I'm pleased to be here today. My name is Birunji Crystal. I'm an entomologist from Uganda. And I'm also a malaria survivor, like many people in my country. Malaria has pretty much shaped my entire life. It is the driver of who I am today. And that stems mainly from a core memory I have of watching my mother wiping down my 5-year-old brother with a cool cloth. And she did this all night because he was convulsing. He had malaria. And she was trying to keep his temperature down. Now, I was 10 years old at the time, so I knew that there was a treatment for this disease. But I also knew we just could not afford it. And so we fell sick over and over again, and all we could do was pray. And even then, I knew that that was not okay. It wasn't right that sometimes she had to choose between feeding us or going out to make money to treat a disease. But that was our reality, the reality for so many other people. And it becomes such an integral factor or part of your life that it just seems like that's what's normal. That's what happens. And there is nothing that anyone can do about it. However, when I was 14 years old, the Global Fund was started. So people came together and they decided that where you're born should not determine if you get to live. And for the first time, we had free insecticide-treated nets. We had free malaria treatment. And perhaps most importantly for a family like mine, we had people from the community that were trained to diagnose and treat malaria. So finally, being poor didn't mean that you had to die. And that inspired me. It made me realize that it wasn't undefeatable. It wasn't this, horrible thing that you just had to live with. Something could be done. And I decided that I wanted to do something about it. I wanted to fight malaria. Today, I am an entomologist. I work with Target Malaria, which is a not-for-profit research consortium working on developing genetically modified mosquitoes with gene drive, aimed at reducing the numbers of malaria-spreading mosquito species, thus interrupting malaria transmission. I am trying to save lives. And this is what happens when the world comes together and decides that it's not okay for some of us, for only some of us, to be all right. Because what one people cannot do by themselves, all of us can do if we come together. Unfortunately, not everyone has my lovely story. Because when I was growing up, 1 in 3 children did not make it to the age of 5 because of malaria. Now, the impact is undeniable because that number is now 1 in every 25. Much better, but still not okay. Because there are still people in Uganda that are deciding how many children to have based on the fact that some of them will inevitably die from malaria, a preventable and curable disease. So, we stand at a crossroads because we have been in the fight against malaria for decades, and we have made a lot of progress. But all of that is at risk, thanks to things like climate change, thanks to things like invasive mosquito species. For the first time in over 2 decades, we had local malaria transmission in the United States of America. A mosquito bit someone in America and transmitted malaria to somebody else there. And I don't understand why the world is not more concerned about this. Because as somebody who has been fighting malaria all my life, that for me is scary. We don't want to go backwards. Malaria did not always exist only in Africa. There's a mosquito species called Anopheles stevensi, based in Asia, historically, that has been migrating across Africa. Now, one of the things that protects cities against malaria is the fact that the mosquitoes that spread malaria prefer rural areas. They do not like pollution. They're not very hardy to temperature changes. They are delicate mosquito. This one isn't. It is well adapted to cities. It's well adapted to changes in temperature. It represents a real threat in the fight against malaria, not just to Africa, but other continents as well. And so we've always been in a race against resistance to insecticides, against resistance to medications, and now we're in a race against species migration. We're in a race against malaria. And we have to use every tool that we have in our toolbox. Now, scientists have not been sitting still. There's been a lot of innovation. We have new mosquito nets. We have genetically modified mosquitoes working on spatial repellents. Vaccines, after over 40 decades of work, they are tools coming up. But this is not the time to take our foot off the gas. Because if we do, then what we risk doing is actually going backwards, is undoing the decades of work that people that came before us did, that people came together and said, this disease needs to go. This disease is a problem for sustainable development. Countries with high malaria burdens have up to 40% less GDP growth in some cases. Malaria by itself, by 2030, if we take our foot off the brake, could result in at least $83 billion lost to Africa's economy. But if we fight malaria, it will result in over $100 billion growth to the G7 trade alone with Africa. Africa is the largest growing market, largest growing workforce, but only if we live. And markets is what you need if you're producing goods. Shout out Heineken. So anyway, I think that I choose to believe that as people, we can look beyond short-term gains and interests and really look at the big picture and choose to honor the fight that has gone before us and really see why it is important that malaria needs to go, but also that public health is the center of security, it's the center of development. If my patriarchal parents only had money to send one child to school, it was not going to be the girl. So I guess I will ask you the really important question, which is, I am determined to fight for malaria elimination this generation, to make use of every tool that's available. Will you fight with me?
So thank you, Crystal. And yes, we will fight with you. I think you almost took us through all the arguments that we wanted to present today. So thank you for summarizing the whole meeting. But I also want to hear from our great panelists. We have 4 people speaking. Marion Koopmans will start with a video because she cannot be attending in person. But we have 3 other speakers. Maybe you can already move forward and then I will present you later. But let's first maybe listen to a message from, yeah, you can come and sit. Oh, okay, yeah, you're right. Yeah. Okay, then let's first listen to Marion Koopmans. And I don't think she needs an introduction because all the people in the Netherlands know her for her work during the COVID crisis. So let's hear what she has to say to us today.
Good morning, and thank you for allowing me to share some thoughts here in this event that I'm unfortunately not able to attend, but I hope that I can give you some thinking from my perspective to take along in your discussions. My name is Marion Koopmans. I'm director of the Pandemic and Disaster Research Center in Rotterdam and also professor of virology at Erasmus Medical Center. So I'm very interested in infectious diseases, viral diseases, and particularly those that jump at us, infections that seem to come out of the blue but then evolve into epidemics and pandemics. You all are very familiar with the most recent global example, which was COVID-19. That had a huge impact, lasting impact, but still seems to have dissipated, taken a backseat in the current discussions at national and international political level. And I do not think that's a good idea, and even short-sighted, and I will explain to you why I'm thinking that. One very important reason is that we do see an increase in this type of outbreak, epidemic, pandemic, not necessarily of the same size of the COVID-19 pandemic, but sparks and little bits of fire in terms of outbreaks that are happening all over the world, including in our country. And that has to do with just the globalization. The world is a village and viruses spread in that village. So it is short-sighted if we only focus on our own health issues to deal with. For instance, since COVID-19, we had 2 additional public health emergencies declared by the director of the World Health Organization, namely caused by mpox, monkeypox, that normally was restricted to a specific part of Central Africa, but made it on 2 occasions into a global network and now is circulating and causing illness also in Amsterdam and in Rotterdam and in cities all over the world. Yet, this in textbooks is a type of infection we should have been able to stop, and we did it. So my message is, let's stop thinking about infectious diseases as exceptional events. They happen everywhere, and there seems to be a bit of an acceleration, so they need our everyday attention. And what that translates to is, let's look at this also in a globally collaborative manner by investing in the ability to detect, treat, control and prevent infectious diseases where they happen, whether that is in the global south or in our backyard. And that does require investments where also the Dutch health sector has a very strong historic track record, which is currently faltering a bit because of the lack of investments in recent years. But I would very much hope to see some efforts to get this topic back on the agenda. The Netherlands has a role to play in the global health capacity strengthening, if only for our own benefit, but certainly for the benefit of others in other regions that are less affluent. So thank you. I hope that you can consider some of my thinking here, and I wish you a pleasant rest of the meeting.
Maybe I want to call Frank first up to the stage, and then we have Ed, of course, and Rose. So please come and sit with me. And Frank, you are a professor of global health at the Amsterdam Medical Center. I ask you today because Marian Koopman so eloquently says why it's important to prepare ourselves in future pandemics, but I wanted to ask you to make it maybe a little bit more concrete. How do you do that?
Right, so first of all, thanks for the invitation. So I thought indeed maybe let's explain a little bit what it actually means, pandemic preparedness, because everybody is talking about it. But what it actually means, so imagine what happened back in 2014 in Sierra Leone, where a child ate an undercooked bat. And that bat turned out to be infected with the Ebola virus. So the child gets Ebola, dies, and then family members get Ebola, die, very high mortality. So what it actually means is that what you need is a health system, so there are doctors, clinics that are capable, first of all, to basically recognize that something out of the ordinary is happening, right? And then you need a laboratory infrastructure because you need to be able to diagnose, and maybe diagnose that it is something that the scientists didn't know yet, right? If it's a new virus or a virus that is unknown to humans. And then you need basically a system that allows you to see that this is popping up, that something unusual is happening, right? We call that surveillance. So there's a reporting system. I don't know if people recall back in the 1980s, HIV/AIDS was only recognized in the US because people looked at data and said, hey, something strange is happening. So that is tremendously important to have that. Now, and then once you have that, you need to be able to basically investigate. You need to be able, okay, people need to be able to find out what is actually going on, which means in addition, they need laboratory capacity. They need to have the know-how how to do that. But tremendously important, they need to be able to exchange information quickly within the country, but importantly also between countries. And then also need to be able to exchange laboratory samples, because we've seen it for COVID, right? We've seen how important it is to actually be able, by a specialist laboratory somewhere in the world, to actually make that diagnosis, say, this is a new virus, we need to do something against that. And then in the countries where this is happening, you then need to basically have outbreak control activities in place, which is treating ill people, which is preventing new cases from occurring, which also requires a special kind of skill, and it requires government responsiveness. It requires that you actually have the means to do this. It requires drugs for treatment. It requires perhaps oxygen in case people need to be ventilated. It requires vaccines if those vaccines are already available. If it's a known virus, and then if it isn't a known virus, then of course we need to develop a vaccine, which the world has done so effectively and successfully. I think for the first time in such a very short period of time for COVID-19. But then having a vaccine or knowing how to make the vaccine is just one thing. You need to actually do all the laboratory work, and then a vaccine needs to be tested in humans, in clinical trials. But you're still not there, because you actually need to have the manufacturing capacity to make sure that you have these large amounts of vaccine that are available. And then it is tremendously important to have those vaccines there where they're needed. We've all seen this during COVID, where actually people have called it vaccine nationalism, in which actually the vaccines were not available, for example, for a number of African countries, or only very late. So these are all very important things, and it underscores, I think, the importance of health systems. So that's basically everything that ties together, right? It's infrastructure, it's a health worker force, it's laboratory capacity, it's supply chain, it's the financing of all this, and it's governance, it's surveillance. All these things are really tremendously important, and actually, if you can actually translate this already also to antimicrobial resistance, right? Because that's basically the same kind of things that are needed.
Yeah, we will talk a little bit more about that later. But and thank you. This is the most concrete explanation that I've had about pandemic preparedness in the 4 years that I work for Aidsfonds. So thank you for that. I also want to learn a little bit about what role do we as the Netherlands have to play there. And I have Ed sitting here next to me. You are the CEO of Y Plus Solutions. That's a procurement service agent. Also practiced on that one. But maybe you can tell us a little bit about what work procurement service agents do, but also why the Netherlands is hosting so many of these organizations. So maybe you can tell something about the role that we have to play in that global health economy, if I can put it that way.
Yeah, thank you, Lyle. And great you're organizing this event, by the way, and great to see such a show up. I think we all care for how we adapt to the changes in the current world, and we all struggle how to find our new spot. So we also, as a procurement agent, we do procure for the Global Fund, and I see Marijke in the middle there, so good to see you. All their medicines, so ARVs, antimalarials, also TB medicines, also for the Global Drug Facility. It's to a total volume of about $800 million a year. So not many people know that in the Netherlands we procure all those drugs. We procure for 120 countries directly as well. I think a great example is the oxygen plants we have been implementing as well for the Global Fund as part of the COVID response. And it's great to see. We installed them in 35 countries, and they are for the next pandemic. But what do you guess? And there's some pictures behind me. Yeah, this one. What guess? Well, you don't need to guess anymore. What will be used first? This oxygen, medical oxygen for babies. We didn't have access to oxygen. So, Frank, you were talking about the whole system and the whole how it all works together. You can prepare it for a pandemic, but you can at the same time use it immediately for babies and getting medical oxygen. So that's great work, thanks to the Global Fund. And it was hard work to install those oxygen plants, but that's nice. And your question about the Netherlands, why are there so many players in the Netherlands? We all originate from IDA Foundation, so credit to the students who founded IDA 50 years ago. And there's now 5 of us. So there's IMRIS, there's Medical Expert Group, there's PFCM, which has American roots, but okay, we ignore that for the moment. And it's us. And we try to work with all the people in the Dutch ecosystem. There's Martin in the audience from Cordaid. We also do last mile work. So we believe in innovation. So we can only fix the big problems of this world with innovation. Digital innovation, we work with Pharmaxis, Cordaid. So we developed an app. Sometimes you see a picture maybe of some people who are in a health facility and they don't know how many drugs they have at stock. So the biggest problem is they have a stock out. They simply don't have the drugs. So how do you treat a patient? Well, how cool is it if you have an app on your phone and you can order instantly, your stock is being maintained, drugs are coming to you with one press of a button. And that's now operational in Burundi, thanks to the Dutch government. So, Peter Derek, you did a great job there with the ministry. And it's now used across the whole country. And you see other donors like Gavi. I think there's people in the room here with Gavi who build on this. So you have, imagine you have all the health facilities in the world, in the poorest country of the world. They have a Starlink internet connection. So it's pretty cool technology in Africa. We implement it there. You have one dashboard. You see all the drugs in all the health facilities. You see how many they have. You can reorder them. You can save 50% of the drugs by being more efficient. There's no expiries. There's no stock outs. So that's the work we're doing, and that's what the Netherlands is facilitating. And we use technology, by the way, from Rotterdam and Schiphol Airport for logistics as well. So we work with top sector logistic. So there's a lot happening behind the scenes.
So definitely a role to play for the Netherlands. If I hear your comment, I also want to go to Rose, our third speaker. You are an internalist infectiologist specialist at the Central Military Hospital here in the Netherlands. And we already mentioned AMR a couple of times. I'm not going to try to say what that abbreviation stands for, but maybe you can tell us. And also maybe share with us why this is considered one of the biggest health threats nowadays, and what that has to do with you also being here in a costume and working for the military.
Well, thank you so much. Of course, I'm from the Ministry of Defense, from the military. But my point is that health and security are not two separate goals. They are heavily interconnected. One aspect of that being AMR, and that's antimicrobial resistance, and that's the way how bacteria protect themselves against our drugs. So when bacteria come in contact with drugs and they survive, then they change in such a manner that they become less or no longer susceptible to those drugs, and that obviously limits our treatment options for people who are infected with those MDR bacteria. When people suffer from those infections, the treatments will be longer, more expensive, more likely to fail, therefore causing morbidity and mortality. And when it happens in the military setting, it will also make them unfit for duty, weakening our military. So that's part of the...
And we also discussed it in relation to Ukraine before today. I think in the hospital where you work, you also are facing patients from Ukraine, is that right?
Yeah, nowadays only few patients, fortunately. Sometimes Ukrainian soldiers are being transported to the Netherlands for definite care. But we're trying to prepare ourselves for the case that there will be a conflict on a NATO territory. And then, of course, many more patients will come to the Netherlands. And as the Central Military Hospital is the sort of the end facility for medical treatment for military and civilians in times of conflicts, we will have to prepare for many patients who come there and who probably will colonize and infected with AMR bacteria. So now it's only several patients, which already give us some challenges regarding their treatment. But when there is a large-scale conflict, or if there will be a large-scale conflict, these numbers will increase tremendously.
So it's also important when we think about security to take the health angle in account. And of course, it's easiest to fight diseases wherever they erupt and at the source. Mark, Marion also said that we should not forget Frank. Marion also said that we should not forget the impact of the COVID-19 epidemic. What is it that a country like the Netherlands or other EU countries, other Western countries can do to prepare ourselves against future pandemics?
I think there are several things, and I think by far the most important, and I think it has already been said in the introductory address, that is basically support as much as possible those essential multilateral mechanisms, WHO being by far the most important. Because the WHO is the organization that is able, because it's an organization of member states, that is able to basically close agreements with those member states that are legally binding to those member states with regard to what needs to be done. So we have the international health regulations that have been in place for a long time. Those are, for example, about measures that can be taken by countries in case of an epidemic, for example, with regard to and also with regard to prevention in cross-border traffic. But for example, also it defines what needs to be reported in terms of disease at the international level. But as of this year, we also have the pandemic agreement, a really tremendous step forward, where actually member states have actually said, okay, we make certain agreements that are legally binding to us on an international law with regard to what we will do in case of a pandemic and how we will prevent a pandemic and what kind of things need to be in place at the country level, what the government responsibilities are in this regard. And for example, also very important, the thing I mentioned, which is the rapid exchange of information and laboratory samples. That is also covered by this pandemic agreement. So it's tremendously important. So that is a very important thing to support. And as has already been said, I mean, they have an important coordinating and normative role here. There are also a number of mechanisms that underlie this. So there are financing mechanisms that underlie this. For example, the Pandemic Fund. There are a number of others. There are regional funds with involvement of regional investment banks. Pandemic Fund has the involvement of the World Bank. IMF has a similar fund. But in addition, there are a number of organizations, multilateral organizations. Some of those are actually represented here. We have the Global Fund. I think the Global Fund has focused, as has been said already, on these three big diseases, HIV, AIDS, tuberculosis, malaria. But that in itself has built a lot of capacity that is now being used. Actually, a long-standing collaborator of mine, also in Uganda, Professor Moses Joloba, he set up with Global Fund funding the reference laboratory, and that's a high safety laboratory because tuberculosis bacilli are dangerous to work with. It's a high safety laboratory with Global Fund funding, and actually has now been the one who has been capable of basically sort of controlling small outbreaks of Ebola because he has that capacity and actually been able to make that mobile. So what a country like the Netherlands should do in the first place, support those international mechanisms. A second thing that I think is tremendously important is to facilitate any sort of exchange of know-how for pandemic preparedness, but also in case a pandemic occurs. So that's about technical assistance. We are very strong in this regard in the Netherlands, right? So we have virology very strong. We already see here with, for example, supply chain. A third that I think is very important is to facilitate and where needed support product development, because the product development, so I'm talking about diagnostics, drugs, vaccines, those are things are tremendously important. And then finally, I'm an academic researcher, so I think some a bit of speaking to my own constituency, if you will. I think it's tremendously important to support research capacity, because without, and I think Marion already made that point, without having strong research groups, without training new researchers, it's going to be tremendously difficult to do all this.
Hey, and you talk a lot about different kinds of support that are very important. We also see that a lot of the funding that maybe came from donor countries like the Netherlands, is very much under stretch, right? Governments are cutting funding for international development cooperation. And I also wanted to ask you, from your role as a procurement service agent, how do you see the impacts of these cuts on the ground? Is there some things you cannot procure anymore? Or can you tell us a little bit about that?
Well, we can procure if we have the money, but a lot of countries have to do it themselves now. So sometimes they even didn't know how much HIV-infected people they had in a country because there were parallel systems. You see now a shift towards countries doing it themselves. They're proud. So the Africa CDC has taken initiative for pooled procurement, and then we can play a role as the Netherlands and I+, because we have the knowledge of pooled procurement, and of course the Global Fund will continue, and there's more domestic funding also generated through the Global Fund. I think the Netherlands can do more. I think what the Netherlands can also do more with their ODA money is try to work better with partners. For instance, there's a foundation called the Buffett Foundation. Not many people know. We work with both Gates Foundation, Buffett Foundation, but they have 50 billion to spend. While Mr. Buffett is still alive, and he's 93, I believe. So they do tickets of 500 million, yeah? So if you have family planning, you want to fund a project, you can get 500 million of Mr. Buffett within a month. Yeah, so it's simple as that. There's only 18 people who work for him in Kigali. We are close to them. So I think if you really combine and leverage the small amounts of money the Netherlands has and try to leverage that with others, you can make a big impact. And we have one example in Burundi where the Netherlands started with the project, and now Global Fund, Gavi, they're all contributing to that infrastructure. So I think it's smart use of the money that's really important.
So you say a lot is still possible, even though the international funding environment is challenging. I also heard you plead passionately about innovative solutions, and I heard something about drones. Can you share more about that?
I hope there's a picture of it. Yeah, we work with a Dutch organization called Wings for Aid, and they developed a plane with 8 boxes of 30 kilos. So it's a big drone. It's a real airplane, but it's without a pilot. And you can drop those boxes on a milk round, we call it. So you do a round in rural areas. And they have a crash zone, so the medicines are not impacted. We do a pilot with them at the moment in Kenya. And there's a lot of interest from the military at the moment because they need those same capabilities of dropping boxes to people. Maybe Rose, you know more about it. But
No, I'm not very much into the drones.
But they can definitely be very useful and also an innovative solution to get the medicine where they're needed most.
And the pilot is funded by the Dutch government, maybe good to say.
Nice, nice. Rose, you just talked about AMR, how big of a threat that is, how it also plays together in issues around security. We, of course, live in a time and political time that the issue of security and conflict is very much at the center stage of our political debates, but also a concern of many people. Do you feel the topic of health is properly addressed in the way that we discuss conflict and security nowadays?
No, unfortunately not yet. It's getting better and it's getting more and more attention. I'm here now, for instance. Yeah. But I think the fact that, chances of a large-scale conflict have never been as big as they are now, at least not for the past 8 decades. And what we see happening on an infectious diseases point of view in Ukraine, for instance, is that almost 1 in 3 of the infections are caused by bacteria that we do not have any antibiotics for anymore. So we see a lot of very dirty, large wounds. AMR develops in hospitals, but also in other places where a lot of antibiotics are being used, like livestock farming, agriculture. All those bacteria get in our groundwater and environment. So if you have like large grenades, rockets, roadside bombs, you get dirty wounds, and all that soil, including the bacteria, are then colonizing that patient. Subsequently, it takes quite a long time before the soldier ends up in a treatment facility. They don't have any microbiological testing facilities, or hardly any, so you start broad-spectrum antibiotics, then it takes a long time before they are transferred to other medical treatment facilities. And this is sort of like the chain of events that increases AMR drastically. And the worrying thing is that we don't only see that in the Ukraine, we also see those kind of AMR resistance prevalence numbers in the Baltic states, for instance, in Poland. So if there would be a new frontier on the Baltic states, which they are now at least taking into account for the coming like 5 to 10 years, then all those patients will be transferred to the Netherlands. And then we need those antibiotics, which are not available or very limitedly available, or are being produced only in China and India. And we are not sure if those pharmaceutical industries will be on our side with a big conflict in the future. And apart from the infectious point of view in healthcare and conflicts, you also have, of course, the climate change, the conflicts regarding the limited resources, conflicts over water, migration, and everything has an impact on transmission of infections, of health problems, etc., etc. So I really think that health and security go hand in hand.
And I see also a graphic there, but is it true that more people die basically from disease if such a conflict happened than?
Yeah, that's true. Yeah, that's been so for like all large-scale wars.
Yep.
Of course, the pictures you get are the amputated limbs, etc., etc. But most wars are being decided because of large infectious diseases already in the Napoleon times.
And what if you were the Minister of Defense? They were making a new government. I'm not making any recommendations, but what would you write in your policy document to do something about this?
I think it's very important to have more production of antibiotics and other drugs in the European context or in a NATO context, so that we are more, we have availability over drugs when the shit hits the fan. I think it's important to have a strategic stockpile of antibiotics because production of course takes a long time, so that you have initial treatment facilities for the patients that come initially. I think it's very important, I mean, with such large numbers of AMR, you can almost see normal infections as a CBRN, like biological warfare, so you need to have very large decontamination policies, strategies. You have to cooperate with your NATO allies on the eastern border because they already have their protocols for treatment for their resistance data. Well, of course, you have to do the vaccination and et cetera, et cetera. But there's quite a large number of things that need to be done and that need time to be done, so you have to start now in order to have things in place when the problems start.
Yeah, we elaborated in the preparation of the stockpile because at the moment in the Netherlands we have a stockpile of 30 million in Vuren for all the TB medicines, AMR in the world. And I already said in preparations I'm going to organize a field visit. So anybody who likes to join, let me know. But we can do that in the Netherlands. We have the logistics, we have the warehouses. We need 50 million maybe. I don't know how much money you need, but I guess about 50 million to stock those necessary life-saving medicine. But if we don't do it, you will be too late.
Exactly.
Because procurement takes 6 to 12 weeks to get them to the Netherlands. So if there's a war, you're too late.
Yeah, exactly. And when there is a large conflict, we as the Netherlands are not the only ones that need those antibiotics. But all our NATO member states or our enemies need the same antibiotics because they have the same infectious problems. I mean, bacteria don't take sides; they infect everybody.
Exactly.
So we have to be sure that we're first in line instead of last on the line, which we are often now.
Yeah.
So that's, and they don't stop at borders, bacteria, just as viruses.
Yeah.
So I maybe want to end our conversation today, but also by asking you, Frank, the same question that I asked Ed earlier. We see that there are significant cuts in the global health field. You just pleaded very passionately about the multilateralism and the investments that are needed there, also about the diplomatic response. But how do you look at the current political times, and what are you asking from our political leaders to get this issue back on the agenda?
Well, I think the things that are already mentioned, right? But what we see in addition, so there are grave disruptions currently to health system strengthening programs, disease control programs. The forecast in a paper in the Lancet a couple of months back of that we can expect if we don't have alternative funding from the funding that has now been withdrawn by the US government, we'll probably be looking at 14 million additional deaths over the coming 5 years. So that is really huge. And obviously we need more domestic funding, we need more efficient spending, but that's going to take time, right? And I think we're now in the sort of crisis mode at the moment. I think the very important thing is to make sure that we don't see further diminution of what I would call the multilateral force and capabilities that we have, right? So keep investing in the WHO, which I think already was announced this morning. It is a very important thing. Keep investing in those multilateral organizations. But the thing that in the long run worries me most is what we are now currently seeing, which is epidemic denialism, which is health nationalism, which is a very strong anti-vaccination stance, and that all in a toxic mix with an anti-science position. Jay Bhattacharya, who was the Trump appointed director of the NIH, which is the largest research funding organization in the world, right? US NIH. When he was asked recently at the seminar of the MAHA, Make American Healthy Again movement, what he would do in response to a pandemic, he basically said nothing. Because we don't need anything. We don't need protection. If you're healthy enough, if you take your vitamin and supplements daily, you're okay. There is no scientific basis for that whatsoever. Robert F. Kennedy is actually now threatening to abolish some of the very effective vaccination programs in the US. I think, and that is what we're up against. And we're up against, I think, a trend. If we would sort of copy that in Europe, we are, for the next pandemic, we are bound to see something that's much, much worse than with COVID-19.
An urgent call to action. And first of all, I want to have a little applause for all my panelists. But we do have 10 more minutes to maybe for the audience to ask some questions. So let's see if this thing works. Is there somebody that wants to ask something to one of our panelists? Oh. Everybody's shy.
Ja, ik krijg al dat.
No? Okay.
Well, you always need to give them a minute, right?
Okay. Think about it. Yes.
Yeah, there you go.
Yes, good morning. My name is Paul van den Berg. I work in Cordaid. I have a question to Roos. There is a Dutch global health strategy that was, that is owned by the Ministry of Foreign Affairs and the Ministry of Health. How does the military play a part in that? Is there a sort of intergovernmental or interdepartmental collaboration or?
Good question. Not that I know of, but it may also be my mistake. I mean, I'm a clinical doctor, and I'm not on a daily basis in The Hague. So, but up till now, I know it were two very diverse worlds. So, but maybe it's already being started. I think it would be good if there would be more collaboration.
And while we wait for another question, I think what has not been mentioned is the private sector in Africa itself. So we talk a lot about the public sector, but if you're a patient, a lot of the medicines are not available in the public sector. You go to a pharmacy and there you buy if you're lucky, non-substandard malaria medicine. So the private sector is becoming more important, but also for non-communicable diseases. If you have diabetes or cancer, those medicines are simply not there yet. So we're also active to see how the private sector can be more buying better medicines and face-based. 1/3 of the medicines still go through the face-based channels. I just want to mention it so we not only look at the public sector.
And I think that's also part of the Dutch foreign policy to include the private sector in these kind of consultations.
Yeah.
Anybody, any questions? Otherwise, I want to invite, oh yeah, there's one more. There you go.
Probably mainly to add, or maybe
Yeah.
if the others can contribute, the mention of local resource mobilization earlier in your discussions. Can anyone elaborate on that? How are the countries responding that are actually now experiencing funding cuts?
Yeah, thank you, Linda. And I will keep it short. I think Frank has an opinion here as well, and Rose maybe as well. I think very different. Some countries really step up the game and they really make a good policy and want to really understand what's happening and fill the gap. Others are really doing nothing and everything in between. What I see in Africa is a lot of governments are proud of themselves. So there was an address from the former Kenyan president who said, okay, USA is pulling out, we can do it ourselves, we are good. I think there's some truth in that it would be great to see more active policies from the governments, but the reality is they don't have the money, most countries. So we still need to work together. But you see certain countries really stepping up and becoming more active. But it's going too fast at the moment, and there's a lot of patients who suffer. I don't know whether you saw the publication in, I think it was in Nature, that due to the USAID pulling out, there's already 24 million people going to die just by that single signature of one man in this globe. That's really strange. Well,
maybe Frank.
Basically nothing to add. I think you've just summarized it. Yeah.
Yeah, and I think also we asked the question, I mean, should governments do it, but it's also, can they do it, right? Are the resources there? And there I think we have a role to play as donor countries, but you also have to look at issues like debt and debt relief to make sure that people can actually do what we're asking from them.
Also for the MPs in the audience, I think it's good to reinvent ODA. You know, the way we've done it always, we need to really think, how can we best spend the money? The Netherlands is still spending 2.4 billion. That's still a lot of money, but you can leverage that 10 times if you do it in a smart way. So it's 24 billion if you do it right. I think we have not always untapped all the other possibilities that are there in the international context. And also focus. I think SRH rights, Netherlands has always been great in that area, but with family planning we can do so much more. We all remember when Lilian Ploemen started See the Site. She raised 180 million in 6 weeks because the USA was pulling back. That was the first administration of Trump. Now, if the second one, it's even more devastating, the result, but I'm sure we can do more if we team up with other countries. So, well, happy to elaborate more.
One last question for Beatrice, and then we have to move to the next segment.
Beatrice Stickers from KNCV. But I just know that the question on domestic financing and resource mobilization is so key to this. And we do have experts in the room here. That's one that has just come back from the field. The Global Fund is doing a lot on public financial management. I wondered if one of those, you know, either Diego or Marijke would like to just, for the broader audience, say, you know, what is being done practically and how it's working.
Okay, thank you very much. So my name is Dagu. I just came back from Ethiopia, so if you hear some difficulty with my voice, it's a change in the extremes of weather. So, in terms of domestic resource mobilization, I came back from Ethiopia, so they were saying proudly that they have quadrupled the amount of domestic resources for communicable diseases, for example. But when you take that in terms of numbers, so it has increased fourfold. But what was the baseline? You know, it was initially it was very small, and now you have increased. But when you go, we went to the field, and we went to the health centers, to the remote sites, and you don't see the effect of that on those areas. It has not reached there, and that's because of the huge gap that's already existing. For tuberculosis, for example, the funding gap is 48%. Whether you increase it domestically, by fourfold or tenfold, it will never fill that huge gap. So that is the challenge that we have witnessed in the field. Yeah.
Thank you. And thank you for being here. I want to thank my panelists for today. You can go back and have a seat because we have a last segment. Thank you. Yeah, you're welcome. Yeah, sorry. And then we have two MPs sitting in the room, members of parliament, Susanne Kreuger from GroenLinks PvdA and Alice van Ark from the CDA. Please do you prefer to stand actually or to sit? Yeah, you can choose. Yeah, let's have a seat then. Thank you so much for joining us today also. Maybe Alice, I want to start with you. It's your first month in Parliament. Yes. How is that to be part of the Commission also on Development Cooperation?
Well, thank you very much. Well, it's actually a very new environment. I have also learned there are a lot of procedures. There's actually a booklet, and I heard from one of my colleagues, you have to learn it by heart, because if you learn that booklet about all the rules and regulations, that's the power. So that's something for the Christmas break, because I've discovered there are more than I know at this time. So it's a really the world of the procedures is world. It's a world on itself. Yeah.
We thought it was all about the good arguments, but the procedures are also very important.
No.
Susanne, you are a bit longer in Parliament, but are you new in the ODA Commission, or have you done this commission before in a previous capacity?
No, I've been a member of Parliament for 8 years, but only been on this topic for the last month or so. Yeah. Previously, I worked on a lot of different topics, climate issues and migration and a lot of other things. But now, after 8 years, I have the topic that I really desired.
Yes, finally. Well, welcome in this marvelous community also. Maybe for both of you, the question, what we can start with Alice. We had many speakers call upon us, all of us, to put global health on the agenda from an economical perspective, from a perspective of what the Netherlands has to offer, from a security perspective. Can you share a little bit how you feel global health, how you view the conversation today? I'm going to ask a general question. We can become more specific later.
Yes, thank you. Well, I think, it's also... maybe good to mention that it's very good. I think that we have this conversation today. Yeah. We see that global health is more and more important. We see also the negative side effects of the drastic cuts that have been going on in the whole world, not only in the Netherlands and in Europe, but also the rest of the world, of course. So it's very good that we discuss this topic. As CDA, we want to still prioritize this topic, hopefully also in the next years. I'm happy that this current government still has put global health as a central theme. So we haven't totally neglected it, but we still have focused on the topic. So that's the good side. But as I think the COVID-19 pandemic also showed us, of course, that it's super realistic that we are getting also a new pandemic anytime soon. That also we have been, I think, in Europe also a bit how you say that has been a lot of egoism, right? We have also seen that even though we want to share the vaccines, we have also really managed to keep the vaccines for ourselves. So that's also something for myself in my mind that I think if something happens again, we really need to prevent that to happen. Because it will happen again, and also if we don't change that. So
no vaccine nationalism.
Absolutely,
I think we can definitely agree with that. Susanne, how did you listen to the conversation that we had today?
Yeah, I thought it was a really rich conversation with a lot of different elements in it. And one of the things that I really, really struck a chord with me was the whole push for keeping our multilateral organizations strong and healthy, and how incredibly important that is. And I think that, well, we see that on a lot of different topics, whether it's climate politics or whether it's security, or we need to have a global community that works together, and especially on health topics and epidemics, it's vital. And it's really worrying that whole multilateral world is slowly, falling apart. And I also thought it was really interesting, the whole link between security and safety and health, and how I see it in a lot of different topics, that right now, of course, the global threat, the threat we experience in Europe, like you mentioned, had the biggest threat in 8 decades. It feels sometimes that it's very narrowly focused on investing in defense material, and not in all the things that come with it, whether it's information integrity, whether it's keeping our own democratic institutions healthy and strong, whether it's investing in health. So I think that's really important, that we start looking at our safety as Europe in a very much more holistic sense.
Yeah, we definitely agree with that. And maybe, Alice, to continue with you on that conversation, what opportunities do you see also in discussions about security, defense, how to position health there, and maybe you have some advice for us as civil society to bring that discussion to the table with decision makers?
Well, one of the things, I think it was an interesting question. I think it maybe was from Paul from Cordaid about if, for example, defense is involved in the global health strategy. I thought
They were consulted, but how involved they are now, that we don't know.
I think this is not something you can do apart, and I think it's also not something you can only do from the Ministry of Foreign Affairs. It's also other ministries, for example, the Ministry of Health should be involved. I think this is not a topic that you can work as in silos. So for me, that's something maybe to work on in the next years, like how to collaborate not only internally here in the Netherlands, but also with other European countries. Because I think in the end, we're still a small country. We have a lot of knowledge and a lot of knowledge on global health and innovation. But if you want to make impact, if you want to use that leverage, you need to really collaborate with others. Otherwise, we don't make that huge impact that we really want to make.
I agree. And I think this is some of the questions that I wanted to ask you, but also I want to leave the room open. But the last questions I wanted to ask you is also, of course, we're looking to make a new government. Different parties are involved in different capacities in that process. But maybe what opportunities do you see to position health also in Dutch foreign policy, thinking about the new government formation and the agreements that are going to be made? But maybe I will look first at Alice.
I think that makes sense.
Yes.
Well, of course, I hope it will be, again, a priority. I think the Netherlands has really much to offer, and I think we should really use our expertise, not only on the food and water management, what is often also heard, but also on the global health. So I hope to see that back. Of course, the topic on the agenda, I think we should keep it on the agenda. Also, the cooperation with and the investment in multilateral organizations. I think that's also, that has always been a key point. And not to forget, I think, the attention that we need to pay to women, girls in the whole strategy. I think that's maybe sometimes a little bit neglected, that if you don't focus on women and girls, they're most often worse off than other groups. So hope to keep that in focus.
We're also going to talk about that in more detail in one of the tables that we will have afterwards. Maybe the same question for you. How do you look at the formation process? And,
well, from the outside. No, I mean, I think for us, first priority is getting the funding back up. I mean, we've seen draconic cuts globally, but also in the Netherlands, that have a very big impact on civil society and on health community. So getting the funding back up is really important. And then, I think a lot of the things that Alice says about the focus on women and girls, and also I would like to see more on the, how do you call that? Sort of the preventive side and also the connection, for example, with, how through other in other ways that we impact health globally. So, for example, through international trade, there is an impact, and both positive and negative. So I would like to see a bit more of that collaboration. Yeah.
And the climate and how that impacts health.
Exactly. Yeah.
That's another conversation that we should definitely have, but I also want to give the room the space for one question. That's the max I have to offer. And one person was also the quickest, so let me give you the mic.
One question.
Yeah, that's also always the trick, right? Put your hand up first. Thank you very much also to all the speakers before, and to Alice and Suzanne to be here. You already mentioned the importance of working also with your colleagues in other committees. You mentioned health, defense, but I think what we've heard before this morning is how there's a risk when health security depends on funding that is volatile and funding that's from charity. So, with the cuts in ODA, we've seen actually what that does. So my question is, would you also foresee working with your colleagues in the Committee on Finance, for instance, to look at more sustainable funding streams to fund for these global public goods, including health security? Lyle already mentioned debt as an important problem. Also illicit financial flows, tax dodging is what is costing governments across the globe a lot of money.
Well, I take the mic. Well, who wants to go ahead first?
Yeah, no, I think really important to look. That's also why I brought up trade, but I also think that with the finance, our impact on countries' economic positioning and the abilities for them to invest in health is more than just the funding through our ODA budget. So really important to seek that collaboration. And can I make one point while I...
Of course.
I just wanted to... one point you were making about information integrity, I would call it, or the fight against disinformation. I really see that also. Before this, I did 4 years of, I was the climate spokesperson. And in that whole domain on climate change, you see an immense disinformation campaign that really resembles the disinformation campaign on infectious diseases and vaccinations. So I think it also, in order to keep us in order to protect our safety, it's dealing with disinformation is really a key issue. So I think also with the, what do you call that, the digital, commission of our parliament, we should also collaborate with them on that. Yeah.
And some final words from you also?
Yeah, maybe in answer to your question, I think it's very important to just... very important also to look holistically. For example, I think you mentioned as well, look also at debt relief. I think many of the countries in Africa have huge debts, and they spend a lot of the money instead of they cannot spend it to their own global health system, but they use it to pay their own loans, so to say. So I think if we could also work on that and pay attention, then we can also help to finance their own global health system. So I think that's also very important, not only to look at purely the research and the pandemic preparedness, but also at how the countries can pay for their own global health system.
I see two strong allies for global health and development cooperation. So we will have more conversations in the months to come. I want to give the people also applause and thank you for coming. This brings us to the end of our plenary program. There will be 2 more sessions here in this room and the other room for a select group of people. For those who will not take part in that, I want to ask you in the next 5 minutes to go to the next room. I had to be strict, my apologies, but we will join you later on, and there's some drinks and food for you ready. So thank you.